Hi, this is Marcy White at Copley Acupuncture. I wanted to talk about migraines because this is one of the top reasons that I see people in my practice. It's the third most common disease in the world, and it affects about 1 in 5 women. So that is a lot of people that are struggling with this condition. I have migraines myself, and I've been dealing with them for the past 10 years. Now, I didn't always have migraine headaches. My mother has migraines, and most people that have migraines understand that these run in your family. So it is a genetic condition. Now, the thing about these types of genetic conditions is that there are some people that may have multiple people in their family that have this and then they never get it. Some people have it at a very young age and some people later in life. So I personally did not develop migraines until much later in my life, and it actually happened after a head injury. So genes. And then something needs to turn the gene on. So let's look at genes as a lock, and then what's called epigenetics are the key. So something has to come along, turn it on. What are the epigenetic factors? Head injuries, hormones, stress, food allergies and sensitivities, tight muscles and whiplashes and injuries. There's endless things that can turn on these genetic predispositions. So once you have migraine headaches, it's really different from person to person how it presents. So everybody has a different pattern, basically. Now, we talk about migraines in conventional medicine. There's 7 different types of migraines. In Asian medicine, we don't talk about migraines in that terminology. The word migraine didn't even exist in Chinese medicine. They talked about headaches and what are called the patterns. So an example of a pattern of headache that we might see as a migraine would be something called blood stagnation. Blood stagnation's defining symptom is stabbing fixed pain. So people with blood stagnant migraines have an ice pick stabbing behind their eye. And it may get worse with their menstrual cycles when blood is supposed to be flowing and they have terrible menstrual pain. Another type of headache or migraine in Asian medicine, a pattern, is called dampness. Dampness occurs with damp weather patterns, barometric pressure changes, storm fronts, or with eating really damp foods. So if this makes sense, this is why one person might say that they stopped eating cheese and dairy and drinking alcohol and their migraines went away. And then the other person says, well, that sounds great. And then they try it and their migraines don't go away at all. Everybody has different patterns. So that's how we treat this in Asian medicine. So we're going to give you a treatment plan that's basically going to be addressing your pattern and then treat it in kind of the opposite way. So if you have dampness, we need to take damp foods out of your diet. You need to take herbs that have a drying effect in the body. And, again, if you're new to Asian medicine, these terms might sound a little strange. In blood stagnation, we want the blood to be more, moving. And that's one thing acupuncture can do. Now, if you want to look at this from another perspective, and I love this way of looking at migraines, we can talk about it in terms of bucket theory. So let's say every person has their own individual bucket. And what happens in migraines is the bucket fills up and it fills up. Bad night's sleep, dehydration, got your period, food allergies, major stress at work, and then the bucket spills over and you get a migraine. So the whole goal in the treatment is we're trying to make your bucket bigger so there's more space. So some people wake up in the morning and their bucket's 5% full and they're dehydrated and they forget to eat and their boss is yelling at them, and it could take a year for that person to get a migraine headache, whereas someone else might always be 90% full and they get a migraine 4 or 5 times a week. And I see a lot of these people in my practice. So what we want to do is we want to do things that make your bucket bigger. We're going to do acupuncture and some manual therapies to make sure all the muscles are loose in the neck and in the whole body and help if there's spinal misalignments. We want to work on your hormonal balance so that that bucket's not getting filled up when you get a period or when there's big fluctuations, especially women in perimenopause. We can do treatment on the vagus nerve and the parasympathetic nervous system to help with stress input to the brain to bring that stress level down so that doesn't fill your bucket. So you get the idea. There's a really great tool that I use that stimulates nerves on the tongue and something called the trigeminal nerve. A lot of these nerves feed into the brainstem, and when they reach a threshold where you've been stressed for too long, the bucket fills up, you get a migraine. So all of these different types of therapies are making that bucket bigger. So I hope that this video is interesting, and if you do suffer from migraine headaches and you have not tried acupuncture, if you find a qualified person that can help you find your pattern and give you a good treatment plan, I hope that that will be helpful to you and give you some relief. Thank you for watching.